Welcome to Our Seniors Radio, a nonprofit dedicated to honoring our seniors by providing relevant information on senior needs. From health, wellness, and lifestyle to residential, medical, and legal, just to name a few. Our seniors and their families are able to make educated decisions and live their best life. Find them online at OurSeniors.org as well. And yes, you can become one of our seniors. Welcome aboard.
Hey, welcome to Our Seniors Radio. And I'm your host, Julian Cantillo, president and founder of all the OurSeniors family. And we'd like to welcome everyone. And as we always do, every show we have a new guest and a new topic to keep our seniors informed, okay? We want to make a couple of announcements coming up. Our next Lunch and Learn at Red Robin at the Pavilion in Port Orange, March 27th. Okay, and the speaker will be Ann Hardick, and she's the area manager for Dignity Memorial. It's from 12 to noon, and yes, it's El Fribo, so please join us, okay? You'll make sure you show up with an empty stomach because it's going to be very yummy, okay? So keep that in mind. And this morning, we have two guests with us, okay, and they represent K2 Medical Research. And I'd like to start off. Please tell us a little bit about yourself. The first guest is Dr. Christopher Galloway.
Thank you for having us, Julian. My name is Dr. Christopher Galloway. I'm an investigator with K2 Medical Research. And just a little bit of my background, I'm board certified in family medicine, and I've been practicing for about 20 years. I did mostly urgent care and some primary care, but for the last 7 or 8 years, I've done only clinical research. And of that time, almost all of it's been primarily focused on Alzheimer's disease, which is why I'm with K2 at this point too.
Excellent. And also with us, part of the K2 team is Santiago Santelis. Tell us a little bit about yourself.
Hi, thank you for the invite. So yeah, my name is Santiago Santelis. I'm a physician from South America. Been here for almost 6 years in the States, and I've been working with K2 for over a year. It's actually today a year. Yeah, it's my first anniversary working with K2. Very passionate about research, trying to also not only to offer research, but also clinical care. I'm trying to get my license to be able to practice here in the States.
Okay, excellent. So, and it's up to whoever wants to answer the question. Tell us a little bit about K2 Medical Research, a little history about them.
Yeah, K2 Medical Research is a company funded by Sean Stanton and also Dr. Brandon Lennox. Their goal is to, there is a stigma about research that is invasive, impersonal, cold. So we are trying to change this and bring research to our communities and let them know how it is and how it works. So basically our goal is to offer clinical trials as a practical healthcare option. And now with partnering with Metro Health, we want to offer what we call clinical research as a care option. So it's basically not only offering options through research, only let doctors know how they can help their patients in the mental or brain or memory status also.
Excellent. And so you are focusing on, I presume, and please correct me if I'm wrong, your focus is dementia, Alzheimer's, etc. So tell us a little bit about what is the difference between dementia and Alzheimer's.
So yeah, it's our primary focus, and especially here as we're now just starting in our new location at Holly Hills, we're going to be focusing primarily on memory. And so that's a common question that a lot of people ask, what the difference between dementia and Alzheimer's. Dementia is kind of an umbrella term. So dementia is a state of confusion or a change in mental status where people are functioning at a lesser ability than is normal. So it can be forgetting things, difficulty focusing, getting lost, any kind of confusion or change in status. Alzheimer's is the most common type of dementia, and it's just under that umbrella. It's a confusion state. The difference between Alzheimer's and the other types of dementia is there's certain changes in the brain. There's plaques that form between brain cells, and there's tangles that form within the cells. And so that's probably the biggest distinguishing feature.
Okay. And as we age, don't we all become a little forgetful?
Yes, that's true. As we age, there's some changes, and there's just life can make some changes. Just there's stresses, and sometimes there's certain vitamins, or there's that can alter that can affect our memory. So it's tricky in determining what is causing that. And that's one of the reasons that we think partnering with Metro Health will be beneficial, because we don't really have a clear-cut way to identify exactly what is the cause of the change in memory. We have some ability to do memory testing that can identify if there's a change in memory, and there's different portions of memory. There's ability to recall, there's directions as a type of memory, or language. So we can target with some memory testing certain areas of what we think is being affected primarily, but to be able to really identify, is this Alzheimer's or is this some other cause, is a little bit more tricky.
Excellent. Wow, that's a lot of information, and we have a lot more questions, and we'll take a break and we'll be right back.
OurSeniors.net provides reliable and accurate information to serve the seniors of Florida. No matter what kind of assistance you need, from home repair to finances to buying or selling a home or considering assisted living, our team is here to help you. Our carefully chosen vendors meet our exceptionally high standards and adhere to the OurSeniors.net Code of Ethics. Want a magazine in your hands? Visit OurSeniors.net or call 386-516-3969.
Hey, welcome back, everyone. And we're excited. We have a lot of information here regarding K2 medical research and what they do. And we're focusing on dementia, Alzheimer's, etc. So please, gentlemen, tell us, what are some of the early signs and symptoms of Alzheimer's disease?
So Alzheimer's disease is a very slowly progressive disease. And again, one of the tricky things is identifying it early. So most people will start maybe noticing some change in memory, but just blame it on their age or I'm getting older. But some of the more common first signs and symptoms are misplacing objects frequently, or someone who is now making notes to remember to finish all of their daily tasks, or getting confused and lost, or starting some project and then leaving it unfinished. And then as the disease progresses, these things become more and more frequent and more pronounced. But simple things like forgetting names, forgetting words when they're talking are probably the more common initial symptoms. Okay.
And it doesn't have to be just that you're old. It can happen at any age, correct?
Yeah, it does. It's not just with aging. There's an early onset Alzheimer's. There's an age range. It's rare that it happens earlier than 50s, but it's so. And again, that may be one reason it's a little tricky. It happens as we get older, but there's kind of a progression with Alzheimer's.
Okay. And what current treatments are available for Alzheimer's disease on the market that the insurance would cover?
So this is one thing that I'm kind of passionate and excited about, as I've done research with Alzheimer's in the last 7-8 years. Recently, we just have a new drug that's been approved. And traditionally, what's being used are medicines that kind of boost memory and kind of help focus concentration a little bit more. They don't alter the disease. That doesn't slow the disease down. The disease will still worsen, but they can help temporarily until the disease kind of surpasses the medication. But recently, we have a medicine that was just approved by the FDA. I don't know that it's widely available or that insurances are covering it, but it's from a class of drugs called monoclonal antibodies. And the way they work is they attach to the plaques in the brain of people that have Alzheimer's disease, and those plaques get removed. And there's a lot of evidence showing that when you remove those plaques, it slows the decline of the disease down. And so a lot of the current research and some of the studies that we're working on are working on this class of drugs that seem to slow the progression of the disease down.
Okay. And so, and going back a little bit, so if the primary care physician thinks that there may be something going on, they can refer them to you guys. You guys will start the testing, and based on the research, that particular patient may become a candidate for that medication, correct?
Correct. And that's one of our goals in partnering with Metro Health, is that they're going to go through their providers and kind of do whatever the traditional treatments are, and they might be on some medicines, but sometimes that's not enough, or they're concerned, or they want to do more. And so research can be an option, both to understand if there's a risk for Alzheimer's or help identify the Alzheimer's. And the biggest advantage, I think, for patients participating in research is we don't charge patients, and we don't bill insurance. We don't ask for the insurance. And so some of these medicines, like the recently approved medications that aren't necessarily covered, are free when you're in the trial.
Okay, excellent. That's great information there, because obviously people are concerned, hey, is my insurance going to cover it, not cover it? How much am I going to go out of pocket?
Correct.
Especially with the cost of medications right now, by all means. And so tell us a little bit about the partnership with Metro Health. Which location, where is it going to be? When can patients come by, get tested for memory? Go ahead.
Sure, yeah. So we're located at the Publix Plaza on US 1, right next to Publix. It's a Metro Health or Holly Hill. The address is 1852 Ridgewood Avenue, Suite 90. That's in Holly Hill again. The phone number if you want to come and schedule, so it's 407-500, so 500 K2, which is 5252. So 407-500-5252. So it's very, quick. Most of these tests are brief. We're going to ask you about, the time, the date. We're going to be also looking for some problem-solving skills and other thinking skills. So it's more than memory. We're actually looking for, it's a brain evaluation.
Okay, excellent. That could be very valuable not only to the patient, but for the family, especially as we know a lot of seniors live by themselves, and they need to keep the family informed, okay, to make sure that they don't become a victim of fraud and scammers because, I just thought it was somebody else, so I gave them the information. So that's extremely important. Okay, we'll be right back.
Did you know that Metro Health clinics are dedicated primary care clinics for seniors? Metro Health treats senior patients with state-of-the-art technology and old-fashioned listen-to-the-patient understanding. Call us now for a no-obligation tour. Interview our staff, ask questions, and learn more about Metro Health's team by calling 386-467-4430. We love and support Our Seniors Radio and Magazine. Yes, you can become one of our seniors.
Okay, everyone, we're back with Our Seniors Radio, and again, our focus right now is regarding Alzheimer's and dementia, and we're talking a little bit about everything, okay? And with our guest, we have Dr. Christopher Galloway and Santiago Santelis, okay? And we've covered a lot of information, but now we're going to get into the real meat and potatoes here. So you hear the word, and there's a lot of companies out there, it's a clinical trial, it's a clinical trial. What is a clinical trial? Why is it important to participate?
Clinical trials are the way that we get medications primarily approved so that physicians can prescribe them and be used. And the main focus for the trials are making certain that the medications or sometimes devices work the way that we want them to work, and that we can understand that there's more benefits than risks, and we know some of the side effects. It's important for people to participate for two reasons. One, we also learn a lot about diseases. So things like Alzheimer's disease, when we're still learning a lot about it, and we don't know that much, it helps us validate if our current thoughts are correct about the disease. It allows us to see if the medication is working, and it gives patients who participate an opportunity to get medications that may not be available, where they're being supervised by physicians in the clinic and study physicians globally.
Okay, excellent. And now, are some of these clinical trials, because you see a lot of advertisement everywhere, hey, get paid to participate, hey, this, hey, that. How does that normally work?
Yeah, so clinical trials, we value your time. There's a commitment for patients that want to do that. We always want to make certain that you understand what the purpose of the trial is, that you get as much time as you need to have all your questions answered, that you understand all the risks and all the benefits to the study. And probably the biggest commitment that people have participating in the trials, there's a time commitment. There's certain things we have to do in a certain amount of time. So there's a payment, there's a stipend that a lot of the sponsors will give for their time in participating. And like we said earlier, we don't charge, we don't ask for insurance. There's nothing that is a cost to the patient. One of my favorite benefits as a physician is we are not seeing as many patients like when I was working in the urgent care. So we have a lot of time to answer questions, to talk about the study, even to talk about other things with the patient. We can spend a lot of time educating them. Any of this, our main job is focused on patient safety. So a lot of times we'll do blood work, EKG, sometimes MRIs, some brain scans, and all of that we can share with the patient, and they can take it to their doctor, so that's all free to the patient.
Excellent, excellent. No, and you mentioned that this may be a great opportunity for the patient to go through all this testing, and then you're saying it would be shared. And that would be great for the primary care physicians, any other specialists that see the patient, to be informed of what's really going on with the patient.
One of my favorite things, just a little side note, currently in Holly Hill, we're looking at a couple of studies that look at what we call biomarkers for Alzheimer's. And those are things that may be ways to identify Alzheimer's earlier. Some risk factors like genes that we know that can be a risk factor for Alzheimer's disease. There's some proteins that cause those plaques we talked about, or tangles, and we can draw blood and check for those. And so we can, in these trials, those aren't always done in the primary care office. So we can draw those and we can discuss them and share that information. And like you were talking earlier, sometimes people want to share with their family if they have risk factors. And so that part I enjoy, Santiago and I, that we can discuss the biomarkers with patients, and if there's risk factors and what that really means.
Excellent, excellent. Yeah, because as we were discussing earlier, the patient may have moved or may have been married. All of a sudden they're widow or widower, and they're living by themselves. They're driving, they're getting forgetful, they're leaving their wallets behind. Things like that can happen, and this is important, that this is something that may go ahead and catch it early and be treated, correct?
Correct. Yeah, that's kind of the current thought process right now with the research in general, is that if you wait until the disease has progressed to a certain point, you have limited ability to correct or slow it down. But the earlier you find people, the bigger that help is going to be.
Excellent, excellent.
That's an excellent question too, because one of the biggest concerns is sometimes they feel like, oh, I don't want to check my memory because I feel like, I'm going to fail this test. I see, a lot of blood pressure cuff out there and scales, right? So everybody wants to check the weight and the blood pressure, even they don't know if the machine works. So it's super nice when we see the patient coming in, they're scared. We know so far that only 50% of the patients want to, check their memory status. So it's super nice when they come and they feel like, hey, I'm having this problem, I'm forgetting things. And I was like, well, I'm also forgetting things sometimes. That's sometimes normal. So when you do the test and they get a good score and they notice that their brain is healthy enough, they're confident, they go out very happy, and that's something we offer for free. So just come over, just get it tested, and then if there is a problem, we'll let you know and we can treat it, as soon as we can. Also, either through research or your primary care doctor. But it's good if you come and at least get tested once and get a baseline.
Okay, excellent. And if, as an example, and I'm just throwing this out as a question, let's say you get tested, or you bring your parents, you get them tested, and they pass. But the wife looks over and says, he keeps forgetting where his glasses were, okay? So the question is, then do you recommend that they get checked every year, every 2 years? What is the norm out there?
Yeah, so we offer memory tests, and we'll let people come back yearly and kind of check that. But one thing I enjoy is we will discuss options. And so with Metro Health in particular, I think that this partnership is going to be even better because they'll be right in that clinic, and we can get them talking to the provider right there. There's maybe medication options, or maybe other resources that can better evaluate the memory if you want to do a more in-depth study than just some of the screening procedures. But we will go over all of that with them.
Excellent. That's a great point. And we have a few more questions, and we'll take a break, and we'll be right back.
OurSeniors.org is the nonprofit 501c3 part of the Our Seniors organization. In 2021, OurSeniors.org was recognized by the Volusia Flagler County SCORE organization as the Nonprofit Client of the Year. Our vision is to provide immediate and continuing care and comfort to isolated seniors in need of human contact. Help us keep all of our resources like OurSeniors.net magazine, Our Seniors discounts, and OurSeniors Radio free for seniors by visiting OurSeniors.org.
Hey, welcome back, everyone. And again, we're having a great discussion here with K2 Medical Research regarding a common issue here that's becoming more and more popular, dementia and Alzheimer's, okay? And we all forget things here and there. So it's important that if you feel you're going through some issues, a loved one, family, friends, you name it, this is a great way to have them tested, okay? And we were talking about that you folks are having a partnership with Metro Health, and just to remind everyone, Metro Health, primary care, they have offices all over Central Florida, but here in Volusia County, specifically Ormond Beach and Holly Hill. And K2 was referencing that they will be there in the Holly Hill location Monday through Thursday, 10 to 3 p.m. And the phone number that was given away to schedule a memory test, etc., 407-500-5252. But I also want to mention that if you're going to schedule a memory test and you have another primary care and you're going to visit that office, you might as well schedule a tour. And if you're doubtful about where you're heading with your primary care, they're retiring, they will no longer accept your plan, etc., consider Metro Health, and you can schedule a tour of their facility by calling 386-467-4430, okay? So we're talking about a free memory assessment. So explain how that works.
Yes, so we have the phone numbers, right? So you can schedule or just walk in. Like I said before, you can walk in and, be worried and super scared about what we're doing, but I'm pretty sure that you want to walk out very happy. So you call us, you make an appointment, or like I said, you can walk in. It's very brief. It takes just a few minutes. We go over some questions. You can also, like I said before earlier, so it's brain evaluation. So you're going to be writing, drawing. We're going to ask you to follow some instructions just to evaluate problem-solving skills and also other thinking skills. And after that, then we determine if you have a healthy brain or unhealthy brain. And then if it's healthy, so we have the biomarkers available that we can detect 20 years before the onset of memory loss symptoms. Or if we determine that you're having some memory issues or cognitive issues, then we talk about the options of enrolling into a clinical trial.
Excellent, excellent. And we'll be right back with a little bit more info here right now.
Metro Health Primary Care Clinics specialize in meeting senior health needs. Metro Health's Ormond Beach and Holly Hill locations invite seniors and caregivers to explore their services with no obligation. Learn more about our primary care physicians in Ormond Beach and Holly Hill offices by calling 386-467-4430 to meet our team. We love and support OurSeniors Radio and magazine. Yes, you can become one of our seniors.
Hey everyone, we're back. And again, we have with us guests from K2 Medical Research, okay? And this is extremely important that if you're having any issues, memory loss, dementia, Alzheimer's, etc., they specialize in that type of research, okay? And again, the information regarding any scheduling to be tested Monday through Thursday, and you can call 407-500-5252 to be able to schedule a visit and do the free testing. So remind us again, it's going to be in Holly Hill. Where at?
Yep, 1852-1852 Ridgewood Avenue, suite number 90, next to Publix. So that's right off US 1 at the Publix Plaza.
Excellent, excellent. And as they get tested and they call and sign up, normally what's the time frame for the initial test? Roughly. For the initial test, if they come to get tested, what time frame?
Oh, okay,
30 minutes, an hour?
Honestly, like Dr. Galloway said, we don't care about time, to be honest. We just want to make sure that the patient is clear enough that we answer all of the questions, concerns, and it might take from like 30 minutes to an hour. So it depends. But we will spend all the time that person needs to be clear and at least answer all of their questions.
Okay, excellent. And if it's a couple, the couple can make appointments for both of them?
Yes.
Excellent, excellent. So give us, in closing here, give us a little background. What do you recommend? What are you seeing? We have very limited time, but go ahead. Anything you want to close with?
One thing I would say is if people are concerned about memory, especially if there's any family history of Alzheimer's disease or dementia, I think research is a very good option that you should think about. And our main goal is to give information, not to try to convince one way or the other, but to give people options. So I think that if that's the case, that you have any memory concerns, you should come and visit us.
Excellent. And go ahead, Santiago, any closing thoughts?
Sure, absolutely. Like, we're looking for patient safety. So just make sure that we're going to do our best to make you feel comfortable, that, like I said, we're going to be there to answer all of your questions. There's not time frame, but we're going to spend all the time you need to answer all of your questions. You can also come. We are located in the Metro Health, but you don't have to be a Metro Health patient to come in. So you are more than welcome to see what we do, ask questions about what research is, and so we're right off US 1 next to the Publix.
Excellent, and a great point, and I'm glad you brought that up. Because, folks, you don't have to be a Metro Health patient. As long as you're calling K2 and you're scheduling the study for yourself, you don't have to be a patient. What we said earlier was if you want to consider looking for primary care and you want to schedule a tour while you're there, you can do the twofer, okay? So I'm just going to close with this, okay? And I hope I don't offend anybody out there, but we all have memory loss, including myself. We forget our glasses, everything. But there's an old song that was around, okay, sang by The Who, the band The Who. So if you find yourself singing, "Who am I? Who, then you may want to go test it, okay? Because then you're going to go around saying, "Who are you? Who?" So we'll leave you with that. But please, Make time to get tested and catch it early, okay? And enjoy the rest of your week, and we'll be back next week. Thank you.
Thanks for listening to Our Seniors Radio. Don't forget to check out OurSeniors.net magazine and tune in every Saturday at 8 a.m. on WNDB. Help support the nonprofit, which is OurSeniors.org, or call 800-647-0868.